Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgery. I've been performing cosmetic or aesthetic plastic surgery in the Scottsdale Paradise Valley area since 1992. And that's all I do. I just perform cosmetic or aesthetic plastic surgery. One of my favorite procedures, and really one of my most common procedures, is a facelift or facial rejuvenation. And people often ask me, Dr. Shapiro, what is your philosophy? You know, why is it that your before and afters, and I'm very humble, I'm not an arrogant guy, but I uniformly, my photos look better than just about anybody's. And people want to know, what is your philosophy and how did you arrive to such good results? The main thing to understand is that I feel lucky because not only technically do I do a lot of facelifts, but I think I have a very nice aesthetic eye. And you want to make sure that that aesthetic eye is compatible with what you think is pretty and looks natural. So my philosophy is that I like to do something that looks natural, that is long-lasting and maintains secrecy for you. I'd like to have it so the scars aren't seen. I like to rejuvenate the face in a way that it looks natural and more voluptuous and younger. I don't know anybody who doesn't want to look prettier and younger. So a facelift should not only make you look younger, hopefully it will make you look prettier in the way that it gives you more proportion, it gives you more appropriate shadowing in photographs. It just makes you look more vital and kind of gives you that it factor that you had when you were younger. And that is why philosophically I always have people bring in some old photographs because I want to see what you look like when you were younger. I do many things with my facelifts. I will do resurfacing. I almost always do fat transfer to give you some of that volume that you've lost. So my philosophy is that when I do a facelift, I'm elevating the deep tissues and I'm having very little tension on the skin. That is important because I want those incisions to heal beautifully and I want no one to know this has been done. Also philosophically, I like you to look prettier, as I said, and I want you to look younger. So commonly, and when you look at my before and afters, as dramatic as the before and afters are, oftentimes or almost always patients come in and they say, you know what, people think I look great, but they can't really put a finger on it. So again, I want this to look very natural and make you look more beautiful. But the paramount thing is that I want this to be a safe procedure. I want you to heal well. I want you to fly through this without any complications. And of course, we talk about the risks and complications, and I want you to do well. So the other thing is that I listen. I think it's very important for me and you to come up with an aesthetic plan, if you will. And I can only do that by listening and educating you about what variables are possible, about the things that I can do for you. I can give you my opinion, but if you don't think that's pretty, then we're not going to do it. So the main thing to understand is that I have the luck of having done this for many, many years. I love doing it. I think I do it very well, but also it's important that I'm not talking down to you. I'm talking with you so we can come up with a plan. And I want you to have such a beautiful result that you'll want me to use your before and after photographs. So the best way to get an idea about if you're a candidate for facial rejuvenation, come in for a consultation, bring in your old photos, don't hold back, tell me what you're looking for, and that's the fun part of my job. Thank you.